Good evening and welcome to Let's Chat with Dr. Celeste MD. I'm your host, Dr. Celeste. I'm your board-certified family medicine physician. I also am an Amazon best-selling author, national speaker, and in addition to that, I'm a physician that helps her patients find solutions for their acute and chronic medical needs through my concierge program as well as my virtual medicine program. So, ladies and gentlemen, just thought that I would hop on and address a question that I was asked by a patient, a few patients actually earlier this week, since we've been doing the COVID testing. And that was, okay, Dr. Celeste, you know that and here in Alabama, our stay-at-home order has ended, and they have relaxed the guidelines to allow you to leave home. So I thought what we'd do is have a realistic chat about some safe ways to practice social distancing. We've been out. I know that I've been to the store several times this week in direct correlation to what we're doing with COVID testing, but while being out, I've noticed some things that are a little concerning in the social atmosphere. And so what I thought I'd come on and let's talk about some safe ways for us to practice social distancing. So now, we already know that there's an order that says for us to wear a mask or a covering over our nose and our mouth at all times. At least in the city of Birmingham, I know that there are, and that's actually throughout some states throughout the country. That is something that they put in place in an effort to try and help protect you. So we want to make sure when we're out that we make sure that we wear a mask. And while I know that it may play a huge part in having a level of comfort that if you're going to reemerge into a social setting, I definitely would recommend a couple of things. One of those things is make sure that you keep it to a group of 10 people or less. And again, while you're definitely safer at home, we're not suggesting or recommending, hey, go out and be socially interactive with others. But if you're going to do it, I encourage you to do it and practice it in the safest way possible. And that means making sure you maintain a 6-foot distance away from other people, and that you use the mask, and that you're 6 feet away from them, but you're using the mask at the same time. There are some people that have been tested this week and have found to be negative, and they feel a lot better and at ease that, okay, I know that I'm not someone that's actively infected with COVID-19. While that is the case, so it may make them feel a little bit better to be socially active around other people, I still would encourage you to maintain small groups if you are going to take that risk. And again, this is definitely not for anyone in that vulnerable population of older individuals with chronic medical condition, such as people with heart disease, people with chronic lung disease, chronic kidney disease. These are people that are more vulnerable to infection. So I encourage you to definitely, it's very important for you to stay at home, and not that we're condoning anyone go out, but if you do go out and around others, I encourage you to do it in a safer way. You want to make sure if you are in a social setting that you're in a well-ventilated area. You don't want to be closed in. If there's an opportunity for you to have a meeting or whatever outside, I would encourage you to do that. In addition to that, you want to make sure that you're keeping that mask covering and that you're still maintaining that 6 feet distance. If you're out at the store and someone else is not doing it, no problem for you to back up a little bit, or if you're in a meeting or something, pushing your chair back, making sure that you maintain that 6 feet distance, and that cloth covering over your face is very important and vital for us to help to protect one another. A lot of questions and concerns I've been getting from mothers and parents is that them being concerned about their kids and what their kids are going through, and so that's something we're going to address on Sunday. I have a very special guest, Dr. Monica White. She's a board-certified family medicine physician, one of my super friends and Muggle sisters, who's going to come and show us some information that will be helpful for parents. So we look forward to hearing her on Sunday to discuss that. But I thought that this was something important for us to address because there's so many people that are out, and there's not, the majority percentage of people, at least that I've seen, are not practicing that social distancing and keeping that cloth covering. So we want to make sure that we encourage you guys to do that. Again, you are safer at home, those vulnerable populations. We definitely recommend that you have minimal outside contact, if any at all. And if you're going to be social, I would encourage you to keep it into a small group and making sure at all times you keep that mask covering and that 6 feet distance. With that, ladies and gentlemen, we want to wish you a good night. Hope everyone has a good weekend, and we will see you on Sunday. Again, I'm Dr. Celeste, your board-certified family medicine physician. I help busy professionals to find solutions for their acute and chronic medical needs through my concierge medicine program, virtual medicine program, as well as my new Amazon best-selling book, Vitality. If you'd like to book an appointment with me, my website is listed there in the chat. Other than that, we'll see you guys on Sunday, and hope to have a lot of parents on to ask some questions as well, as these are issues that have been brought up to me that we're addressing today as well as on Sunday. Okay? Thanks a lot, and everybody have a good night. Bye-bye.